Welcome and thanks for watching Training with IMS. In this video, we'll take a quick look at the Patient and Disposition tabs. As we drop into the Patient tab, we'll be able to populate the patient demographic information, first name, last name, birth date, month, date, and year, the gender, race, phone number, if they have their social security number, followed by their preferred physician, if they're a resident or non-resident, which hospital destination they choose. If we activate a stroke team or trauma team, we can indicate that here, and when we activated the team, what the disposition was after arrival at the ED, the history of the patient, if you can't find anything suitable on the list, you can get to the bottom and actually populate an other value, which will allow you to type. Once we've completed the patient's history, we can then select the medications, pick from a list of popular medications, and then the allergies. Populate a patient's address. If it's the same as the incident address, we can insert that incident address and allow the patient to sign. If we needed to get back to our hospital details, we can do that by selecting the hospital details button, and also the patient's medications. Also available from the patient tab is a signature form. If you're unable to have the patient sign the report, you can get a signature from an authorized representative in the middle section. In the bottom section, you have the ability to populate a crew member signature as well as the receiving facility nurse. Here you can populate the nurse's name, and here you can describe the reason you were unable to populate the patient signature. You'll also find the refusal form under the patient tab. Refusal for treatment or transport. Capture the patient's signature at the bottom for the refusal, and there's also a witness signature. You can print this form. You can also take pictures. You could show them to a receiving facility if needed. Conversion from pounds to kilograms is also available from the patient tab. So we'll move to the disposition tab. We'll choose the type of dispatch that was reported to us, what the primary symptom was, what our impression, the chief complaint, abdominal location, the organ system, and the onset. If there are additional symptoms, those can be populated here. If we did have an injury as a result of an auto accident or a fall, we can populate the injury tab, the type of injury, the acuity upon our arrival, if they met trauma triage criteria, protective gear is also available. And if this was a result of a work-related injury, we can indicate that here. Any indication of alcohol use, any human factors, barriers to care, if it was a mass casualty incident, or also the number of patients involved in the incident. If we look at the cardiac arrest tab, we will be presented with questions such as whether it was witnessed and who witnessed it, the time that they witnessed it, the cause of the arrest event, the monitored rhythm that we got upon our arrival, the rhythm when we got to the ED, if there was any prior aid provided prior to our arrival, and who provided it, if there was an AED on scene, and if so, who used the AED, what the outcome of the AED provided, and if there was any return to spontaneous circulation. The reason for discontinuing resuscitative measures, the date that you discontinued and time, the end of the arrest event, and the types of resuscitative efforts that you had made.